কি নাম আপনার?
সীমান্ত সরকার।
সীমান্ত। বয়স কত?
38।
38। বিবাহিত?
হ্যাঁ, বিবাহিত।
কোথায় বাড়ি?
আমার হচ্ছে ছটা কালীপুর।
বজবজ।
হ্যাঁ, মাস।
এখানে কবে ভর্তি হয়েছেন?
ভর্তি হয়েছে সোমবার। সোমবার।
সোমবার। আচ্ছা, কেন ভর্তি হলেন? কি কষ্ট?
কষ্ট মানে আমার জ্বর হয়েছিল।
কদিন?
মাস 6 দিন।
মাস 6 ধরে জ্বর হচ্ছিল?
আর হালকা জ্বর দুপুরে হয়,
হ্যাঁ।
রাত্রে হয়, এই হতে হতে।
আচ্ছা, তারপরে এইখানে ভর্তি হওয়ার পর জ্বরটা কমলো?
কমেছে, এবার একটু হালকা কমেছে।
আচ্ছা, তাহলে 6 মাস ধরে আপনার জ্বর হয়েছিল।
হ্যাঁ।
আর কি?
আর হচ্ছে রক্তটা কমে গেছে।
রক্তটা কমে গেছে। তো আপনি বুঝলেন কি করে? আপনার কষ্ট কি হচ্ছিল?
কষ্ট হচ্ছিল মানে আমার খুব রাত যন্ত্রণা হচ্ছিল।
হ্যাঁ, আর
আর জ্বর আসছে।
না, জ্বর তো হলো, আর তার
কোথাও গেলে পরে একটু
হাঁপ হাঁপ হচ্ছিল।
কারণ মানে নিজে নিজে ফুটপাত করে যাবো একটু দেখতে
হ্যাঁ,
পাচ্ছি।
তাহলে আপনার হাঁটাহাঁটি করলে পরে একটু শ্বাসকষ্ট হচ্ছিল বা দমের দমের কষ্ট হচ্ছে। তাহলে এটা কতদিন ধরে হচ্ছিল? এই যে এইটা বললেন যে শরীরটা দুর্বল হয়ে গেছিল।
দুর্বল হয়ে গেছে মানে জ্বরটা হওয়ার পরে শরীরটা একটু আস্তে আস্তে আমার শরীর হেভি সইছে।
সেটা খারাপ হয়ে গেল।
সেটা একটু খারাপ হয়ে গেছে।
তাহলে ওটা তো 6 মাস ধরে জ্বর বললেন, আর এটা এই যে দুর্বল হয়ে যাওয়াটা মাস 3 ধরে না আরও?
দুর্বল আমি এখনো নয়। দুর্বল আমি এখনো নয়।
আপনি যে বললেন চলতে গিয়ে আপনার মনে হচ্ছিল যেন একটু গায়ে হাত পায়ে, সেইটা সেটা কতদিন? কতদিন? হুম, 3 মাস, 2 মাস, 1 মাস, কতদিন? 2 মাস হলো। তা সেটা আস্তে আস্তে কি বাড়ছে দুর্বলতাটা?
না, কমছে।
কমলো, বেশ, ভেরি গুড। আর জ্বরটা?
জ্বরটা এখানে 3 দিন হলো, জ্বরটা কোনো দিন রাতে আসে।
আর এখানে ভর্তি হয়ে ওষুধ খাওয়ার পরে জ্বরটা কমেছে?
হ্যাঁ, যে আগে এরকম জ্বরটা আসতো।
আচ্ছা, যে জ্বরটা এসেছিল আপনার
হালকা গায়ে গায়ে ছিল।
গায়ে গায়ে ছিল, খুব বেশি কখনো ছিল না? কাঁপুনি টাপুনি ছিল না?
কিচ্ছু না। কাঁপুনি মানে রাত, এই যখন রাত 2টা 2টার সময় বাজবে তখন একটা হালকা কাঁপুনি আছে, পাল্লা কাছে কাছে পাখা চলছে।
আচ্ছা, ঠিক আছে। তাহলে নাও উই আর অলসো টেকিং অ্যানাদার কেস। দিস উইল I will show you as a short case. I will take short history and I'll go for examination. Here the patient is a male patient, 38-year-old. He presents that chief complaints of fever for 6 months. And number 2, he is also complaining of weakness or shortness of breath for 2 months. And weight loss is also for the same duration. So chief complaints 1, 2, 3, fever, then weakness or shortness of breath, then weight loss. So history of present illness, first chief complaints I have to dilate. Say the fever started 6 months back. Before that he was quite okay. And this fever was not very high, it is a low grade fever and associated with a sort of myalgia like this. There is no high swinging temperature, no other vomiting, headache and other things. And this fever used to come every day. প্রত্যেক দিন জ্বর আসতো তো? প্রত্যেক দিন জ্বর আসতো। রাতের দিকে কি জ্বর বাড়তো? না,
না, জ্বরটা দুপুরবেলা স্নান করার পরে খাওয়া দাওয়া করলে
না, এখনকার কথা বলছি না, যে 6 মাসের কথা বলছি। যে 6 মাস ধরে আপনার জ্বর আসে সেই 6 মাসের কথা বলছি। জ্বরটা কি খুব বেশি 103, 4 এরকম হতো? কমই হতো।
মানে শরীরের মধ্যে একটা জ্বরটা একটা থাকতো, মানে
আচ্ছা, ঠিক আছে, ঠিক আছে। সো
রাত বেড়ে যেত।
হ্যাঁ, সো দিস ইজ নট এ হাই রাইজ অফ টেম্পারেচার। তার সাথে কি আপনার কাশি টাশি ছিল?
না, ওসব আমার নেই।
কাশি ছিল না। শ্বাসকষ্ট?
না।
So it was not associated with associated symptoms, not associated with cough, chronic cough or breathlessness as he is saying. So first complaint is fever, low grade fever for 6 months. Then on dilatation of these chief complaints, It started 6 months back. It's a low-grade fever, not associated with chronic cough, neither breathlessness nor chest pain. Then he also says that he developed weakness for last 2 months, and after walking some time he feels some sort of breathlessness. So this is progressive following fever. Then here also this is not associated with any severe breathlessness or severe cough like this. Third, he also complains of that he has got weight loss. আপনার প্রথম ওজন কত ছিল?
আমার ওজন ছিল মানে আমার হিসেবে আমি মাপি আমার একটা হিসাবে আমার
আচ্ছা, আপনার জামা টামাগুলো সব ঢিলে হয়ে যাচ্ছে, তাই তো?
শরীরটা মানে আগে থেকে অনেকটা ভিড়।
So he cannot say his weight before his fever, but certainly he feels that he has got weight breakdown of health and he has got weight loss. So these are the 3 chief complaints and history of present illness. Then second part of the history of present illness, the after having admitted here and after having some treatment, the fever has subsided, so remission of fever is there, and he is also feeling better. His weakness is also improved. তা কি আপনার এই ওষুধ ছাড়া আর কিছু পেয়েছেন আপনি এখানে? এখানে যে ওষুধ দিয়েছে তাছাড়া আর কিছু দিয়েছে? ওষুধ ছাড়া আর কিছু দিয়েছে আপনার শরীরে? স্যালাইন, রক্ত দিয়েছে। He says that he also received blood transfusion. ক বোতল দিয়েছে? হ্যাঁ, তা 1 বোতল নেওয়া হয়েছে, ঠিক আছে। So he has been advised to take 3 units of blood transfusion. He has already received 1 unit of blood transfusion. So history of past illness, আপনার আগে কোনো অসুখ বিসুখ হয়েছিল? আর কোনো অসুখ হয়? So no relevant past history and family or personal family, বাড়িতে কারো এরকম অসুখ আছে তাদের রক্ত দিতে হয় এরকম কোনো অসুখ? না, নেই। সো ফ্যামিলি হিস্ট্রিতে বাবা মা বেঁচে আছেন? বাবা কত বয়সে মারা গেছেন? না, তার বয়স কত হয়েছিল তখন? 95. His father died at the age of 95 years. Mother alive. ভাই বোন আছে? ভাই বোন কেউ আছে? আচ্ছা, and brothers and sisters, none of the family do suffer from anemia or other this sort of diseases. আপনি নেশা কিছু করেন? কি করতেন? ড্রিঙ্ক করতাম। কি কতটুকু করে খেতেন? কতটুকু করে ড্রিঙ্ক করতেন? মানে গ্লাসের, পেগের? So on personal history, he is an alcoholic. He used to take daily alcohol. কত বছর ধরে খেতেন? 8 থেকে 9, and from 8 to 9 years he is taking regularly and heavy amount of alcohol for 8 to 9 years. Smoke, ধূমপান? He is also a smoker. কটা করে বিড়ি খান বা সিগারেট খান? না, তার আগে 10-12টা না আরও বেশি? হ্যাঁ, he used to take 20 to 25 cigarette না বিড়ি? বিড়িজ পার ডে ফর লং টাইম। কতদিন ধরে খেয়েছেন ওটা? 8-10 বছর? 4-5 বছর, ঠিক আছে। আর কোনো ভারী অসুখ হয়েছিল যার জন্য আপনি ভর্তি হয়েছেন কখনো? কোনো ভারী অসুখের জন্য কখনো ভর্তি হয়েছেন হাসপাতালে এটা ছাড়া? হ্যাঁ, so he has never been admitted for his other diseases in hospital, no other past history. So drug but treatment history I'll collect from the ward. Then this is personal history. What কি কাজ করেন আপনি?
আমি এক্সপ্রেস সিলিন্ডারে কাজ করি, এক্সপোর্ট যে বিদেশে যে ট্রেনের মাধ্যমে যায় ওইটা শুধু
আচ্ছা আচ্ছা,
খবর
হ্যাঁ হ্যাঁ, ওইখানে কাজ করেন। ইজ এ ওয়ার্কার, ম্যানুয়াল ওয়ার্কার, ওয়ার্কস ইন এ ফ্যাক্টরি ফর লং টাইম। সো অকুপেশনাল হিস্ট্রি। সো ফ্রম দি হিস্ট্রি এ বয়স কত বললেন? 38। A 38-year-old male patient, married, who had history of fever for last 6 months and progressive weakness and weight loss, and on admission of this hospital he received transfusion of blood for his ailments, and after taking medicines his ailments, fever has subsided, and he denies any history of cough, vomiting or পায়খানার সঙ্গে কখনো রক্ত গেছিল?
আমি ওটা দেখিনি কোনোদিন, তবে মনে হচ্ছে আমার এইসব সমস্যা ছিল না।
So
বর্তমানে সব শরীর গরম হয়ে
so he so
ঠান্ডা হলে ঠিক হয়ে যায়।
he cannot say definitely whether he passed any black stool or not, and general examination have to perform. I will just do the inspection and just examination of for anemia. খুলে দিন। Now apparent age is, as he stated, age 38 years, build average, nutrition average, there is head, neck, face, and head, neck, no abnormality, and the face, the most definite faces. Then we have to look for anemia. How the anemia is looked for? The lower palpebral, উপর দিকে তাকান, you see, এখানে এটা দেখাতে হবে, just এটা ফ্লেস করো, you see the lower palpebral conjunctiva. It is not anemic because he has received blood. And নিচের দিকে তাকান, there is no jaundice. জিভ দেখান, উল্টে দিন জিভটা, under surface of the tongue, there is no jaundice. Then the nail is not white, partially treated, received blood transfusion. ঠিক আছে, পেটটা দেখি। So here you see there is some gynecomastia is there, and there is blackening of this areola. So this is a sign of hepatocellular failure. So this patient has received long time alcohol, so this may be a case of alcoholic liver disease. From the general examination, from the history, we may say that this could be a case of alcoholic liver disease, compensated alcoholic liver disease. And if you have to examine whether spleen is present, whether venous permanence is present, whether liver is enlarged or not, I am not going to do that. So this is a case of anemia with alcoholic liver disease, as because he has got some features of hepatocellular failure. আপনার কি দাড়ি গোপ আগের থেকে কমে গেছে?
না,
আর সেক্স হয় বয়সে কাজ?
সেক্সটা একটু প্রবলেম, মানে ব্যবহার করছি না, কেননা
সে কি আগের মতো উত্তেজনা? আচ্ছা, আগের মতো উত্তেজনা হচ্ছে? আচ্ছা, ঠিক আছে। And he also agrees that he has some sexual abnormalities. Yes, welcome the first year students for your early exposure to clinical medicine. Today we are at in Female Medical 1 and hospital, and this is our team. I am Dr. Swapan, Sarkar, Associate Professor of Medicine. This is our sister in charge, Mayumi Jain, and others team. And this is our patient. Today we will see this patient as a short case, and then we will show you how we are taking the history and we are examining the patient, come to a provisional diagnosis, and what is the investigation report and what sort of treatment we are giving. In a nutshell, as because you are not exposed to clinical medicine, so it will be difficult for you if you go details. Just I will give over the overview how we see the patient in the ward. We call it history taking and clinical examination. With this introduction, let us start. Now, this is a patient which has been admitted for some time here, and I am going to take the history. In the history, I will take the identification of the patient, what is her name, আপনার নাম কি, বয়স কত, 60 বছর, স্বর্ণলতা মণ্ডল, 60 years old. এখানে কতদিন আগে ভর্তি হয়েছে? So she has been admitted 12 days back here, and there is other datas of date of admission, date of examination is today, and he is married. বাচ্চা কাচ্চা কটা? দুটো বাচ্চা, and mother of 2 children. তো আপনার কি কষ্টের জন্য প্রথম এখানে ভর্তি হয়েছিলেন?
রক্ত কম ছিল।
কষ্ট কি হতো আপনার? কষ্ট কি হতো?
রক্ত ছিল না, রক্ত জন্মাচ্ছিল না, রক্ত নেই।
হ্যাঁ, তো আপনার কষ্টটা কি হতো?
ওই মাথা ঘুরতো।
মাথা ঘুরতো কতদিন ধরে?
মাথা ঘুরতো, অনেক মাথা ঘুরতো, আপনি জোর লাগছে।
কতদিন ধরে হতো সেটা?
হঠাৎ হতে হতে সে পায়খানা বাথরুম যেতে পারছি না।
আচ্ছা, যেতে পারছি না, দুর্বলতা লাগতো। সেটা কতদিন ধরে?
ধরে ধরে নিয়ে যেত।
সেটা কতদিন? 1 মাস না
হ্যাঁ,
মাসখানে?
মাসখানে।
So she is complaining of vertigo for 1 month and weakness for the same duration. And vertigo and weakness, these are the 2 main complaints she is complaining of. Then this is chief complaints. Then we have to record the history of present illness. কতদিন আগে আপনি ভালো ছিলেন?
4-5-6-7 মাস।
So she was quite okay 7 to 8 months back, and gradually she developed weakness and which is progressive, and also she is having vertigo for the same duration. আপনার কি কোনো কান ভোঁ ভোঁ করতো? কানে কোনো অসুবিধা ছিল?
না।
She had no ear problem for the cause of vertigo. আপনার খিদে কেমন হয়?
খিদে হচ্ছিল না।
No. He also complains of anorexia for the same duration. আচ্ছা, আপনার কি জ্বর হতো?
না।
জ্বর টর হতো না? মাঝে মাঝে জ্বর হতো কি? জ্বর
হ্যাঁ,
জ্বর হতো মাঝে মাঝে, খুব বেশি না অল্প? She also, on inquiry, she also gives history of low grade fever for long time. Acha. So this is the history of present illness. Then any past illness, history of past illness. আগে আপনার কোনো বড় অসুখ হয়েছিল? আগে কখনো কোনো বড় অসুখ হয়েছিল আপনার? ভারী অসুখ? ধরুন 2-3 বছর আগে, 4 বছর আগে হাসপাতালে ভর্তি হয়েছিলেন কখনো? 2-3 বছর আগে?
না।
হয়নি। আর আপনার পায়খানার সাথে কোনো রক্ত টক্ত যায়? না। নাক দিয়ে কোনো রক্ত পড়ে? দাঁত দিয়ে রক্ত পড়ে? She also denies any history of bleeding gums or bleeding per rectum, and she also gives history that she has not been admitted for in hospital in the past. Family history is nothing contributed, non-contributory as to shorten our history taking. Then personal history, then ড্রাগ হিস্ট্রি। আপনি আগে কোনো ওষুধপত্র খেতেন কোনো জ্বরের জন্য, কোনো অসুখের জন্যে? আগে কখনো কোনো জ্বর অসুখ কিছু হয়েছিল? টাইফয়েড যাদের ওষুধ খেতেন আপনি?
ম্যালেরিয়াই তো হয়েছিল।
সেটার জন্য ওষুধ খেয়েছেন?
ম্যালেরিয়া হয়, রক্তটাই হয়, জ্বরটা হয়েছে।
কতদিন আগে সেটা?
হ্যাঁ, 3 মাস আগে হবে।
He also says that she had a bout of fever and suspected malaria, and she received typhoid. She received medicine for that, and following that she developed this weakness. This is very important history. So from the history, we collect that she is complaining of weakness which is progressive, and for this weakness she is also having vertigo and she cannot walk, and she also gives negative history, no history of bleeding per rectum or bleeding gums or epistaxis, chronic blood loss. But she gives history of fever 3 months back, for which she was treated, and she says that this may be a fever of typhoid. So with this history, we can have that this patient has got this sort of weakness, maybe some sort of anemia, and that should be discovered which type of anemia is there. And next we will go for examination, general examination. General examination has got certain points from head to foot. Inspection, look of the patient. Looking at the patient, we see that patient is seriously ill. She is not talking very much well, so she is feeling sick. Then from head to foot, ঠিক আছে আমি পরে আবার শুনবো। Then we'll examine her head, we'll examine her face, the neck, then we'll examine her hand, then leg, then edema, cyanosis, jaundice, clubbing, then we'll examine other parts of the body. So today from the general examination probably we'll come to the diagnosis of his ailments. Let us see. I am seeing that her head is normal, there is nothing characteristic. She is looking apparently to her age, she is 60 years, and now I am seeing her facies. Facies is nothing important, nothing characteristic. Now I am going to see her anemia. আপনি উপরের দিকে তাকান তো। You see, here there is anemia, pallor is present, pallor is present. Probably she is partially treated, she received 2 units of blood, and after that this is a pallor is present. Then I am seeing, nicher dike takan, this is jaundice, no upper bulbar conjunctiva, no jaundice, but in a tube light or in a night, jaundice should not be examined. We have to examine jaundice in a daylight. Then জিভটা দেখি বড় করে, there is no glossitis. জিভটা উপরে তুলে দিন, under surface of the no jaundice. There is unhealthy gum. কিছু কি খাচ্ছিলেন নাকি?
না
So anemia to be looked for the lower palpebral conjunctiva, the tongue, the generalized skin, and the nail beds, palm and sole. As she has already received 2 units of blood, so all the florid signs are not present. Then there is no clubbing, there is no polynucleia, then there is no edema. Her pulse rate is more or less 70 per minute, it's regular. Then blood pressure is 110/70 and respiratory rate is 20 per minute. So from the general survey we have detected that she had mild to moderate pallor and there is no jaundice, though she has received 2 units of blood. Then from this general survey we have to go for systemic examination. As here the general survey dictates that she is anemic, so we must examine the GI system and hematological system. আপনি কি এখানে শুতে পারবেন এখানে মা একটু শুয়ে দেখেন দেখি। So let us discuss what we have gathered from the history and general examination. So from the history, a 60-year-old lady, she was complaining of weakness and vertigo for 1 month, but she also gives history very clearly that 3 months back she had fever for some 7 to 10 days, and during that time she received medicine and fever subsided, and following that she is gradually developing weakness. She denies any history of bleeding for rectum or bleeding gums, etc. There is no history of chronic blood loss. So from the history it appears probably she was developing anemia, and for which she has developed weakness following the typhoid fever, and she took some drugs also. Maybe drugs is also the implicating of for the cause of anemia. On general examination, except for moderate anemia, we have found some rise of temperature. There is no edema, and there is no other definite points. So, though patient is partially treated and she received 2 units of blood, her anemia is little bit corrected. Now we will go for examination. What are the causes of anemia, keeping in mind the gastrointestinal system and the hematological system to be examined. I am not going in details, but I will see certain points to come to the diagnosis of anemia. As you know, anemia is a deficient hemoglobin. Hemoglobin, when decreases less than 10 gram, we call it a moderate anemia. In female, it is 13 gram percent. In male, it is slightly higher. But when it goes below 10 gram to between 10 to 8, we call it moderate anemia. And below 8 or below 7, it is a severe anemia. Probably after giving blood, he is still in moderate anemia. So at that time, she had severe anemia. Second, anemia may be of 3 types. Either they are due to deficiency of the elements which causes the hemoglobin RBC production. So iron, vitamin B12, and folic acid, these are the 3 important elements. When they are deficient, there is deficiency anemia. Then anemia may be due to hemolysis. If the RBCs are hemolyzed before 120 days, so this sort of disease we call hemolytic disease, and the spleen will take up the RBC and spleen in enlarge, and there will be production of RBC from the different sides of the bone, from the cheek, from the long bones. As a result, there will be enlargement, and that facies is characteristic. We call it a mongoloid facies, where there is depressed nose and malar prominences, and from the childhood, and there is splenomegaly. And these patients usually take repeated transfusion. And whenever we do investigations and we hemoglobin electrophoresis, we find it is a thalassemia or other group of diseases. Then another form of anemia is when there is production of this bone marrow is suppressed or depressed, and we call it aplastic anemia or hypoplastic anemia. So these are the 3 broad classification of anemia. So with this clinical knowledge, let us see in this patient which type of anemia it is. So I will see whether patient has got splenomegaly or not, whether patient has got any characteristic facies of mongoloid, it is absent, whether there is sternal tenderness or not. Another type of anemia is that leukemia, in which there is sternal tenderness is present. Now I am examining the abdomen, just liver and Joreshasnin, 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 Joreshash, Khub Joreshash, Joreshasnin. No, spleen is not palpable, liver is not palpable, and Tatha, there is no sternal tenderness, there is no neck glands, lymph nodes, anything else. So, splenomegaly absent, there is no hepatomegaly, there is no sternal tenderness, so the hemolytic anemia is excluded. then it may be either deficiency anemia, iron deficiency anemia, or folic acid B12 deficiency anemia, or it could be aplastic anemia. In deficiency anemias, sometimes there is a history, particularly commonest anemia is iron deficiency anemia. So there will be a history of chronic blood loss. That's why I was inquiring of chronic blood loss, either in the form of menorrhagia or bleeding peptic ulcer or bleeding piles or epistaxis like this. But there is no such history. Secondly, there are certain points of iron deficiency anemia clinically. There may be cholinuria, there may be glossitis that are also absent. But if you do some investigations, serum iron, serum ferritin, and if you find under the slide there should be microcytic hypochromic anemia, and we can dictate with this microcytic hypochromic anemia and less serum hematine and serum iron, then it is iron deficiency anemia. But if the cells are more large, we call it megaloblast, then it would be either B12 deficiency or folic acid deficiency anemia. So there is no such clinical history. In pregnancy, usually there is folic acid deficiency. In certain drugs where required rheumatoid arthritis or like that, methotrexate, there may be folic acid deficiency. There is no such history. And vitamin B12 deficiency also, malabsorption syndrome, in celiac disease, and in intrinsic factor is absent where after partial gastrectomy, there is no such history of operation like that. So clinically from this, so the deficiency anemia is clinically excluded. But one point of the history, that patient had typhoid fever, and during that time she received some antibiotics and other drugs. That may be that may cause this type of anemia due to hypoplastic or aplastic anemia. That comes in my mind. So this is the possibility. So from the clinical aspect, we can say this is a case of anemia, most likely may be due to aplastic anemia. Then we have to go for investigations, as I have mentioned, complete blood count, and we have to see the type of anemia, MCV, mean corpuscular volume. If it is less than 80, then it is microcytic hypochromic anemia. If it is more than 100, it is megaloblastic anemia. And looking at the blood picture and the indices, what I have mentioned, the serum ferritin, serum iron, TIBC, we can dictate whether it is anemia, is deficiency anemia or not. But in case of aplastic anemia, there will be depression of the bloods, total count will be depressed and all elements will be depressed. And if you do a bone marrow, there will be also depressed of the bone marrow. So the last investigation is the complete blood examination along with bone marrow examination. So in this patient, and at the same time, we have to treat the patient as there is, if the total count is less, there is pancytopenia, then we have to give antibiotics. Otherwise, there will be fever, there will be infection, and patient is also receiving some antibiotics, and her total count is 3,000 like that, and it shows pancytopenia, and patient is also being investigated in the line of aplastic anemia, and bone marrow has been done, and the report of bone marrow is yet to come. And for so long, she has received 2 units of bloods and other treatments, and also to prevent secondary infections, antibiotic is going on. So it is a case of aplastic anemia. So clinically, from the history, one history point that she had fever for 7 to 10 days and she received drugs, one of the important drugs. Previously, when we were students, chloramphenicol was given. That is an anaphylaxis reaction, and that caused bone marrow suppression. So probably she received chloramphenicol. We have to search for that. Or it may be some other types of disorders in the elderly group, a sort of malignancy, hematological malignancy, myelodysplastic syndrome, or leukemia, that should be considered. That's why the bone marrow examination is very, very important. So with this, let us conclude today that we are showing a case of aplastic anemia. Next day we will show a case of hemolytic anemia, or a case of deficiency anemia, either iron deficiency or vitamin B deficiency anemia. I think you have gone through this very well, and if any question, he will ask you later on. But this is your early clinical exposure. Not too much is necessary. You will come when in the clinical course in the second year will take your clinical methods examination. Then you will be very much well aware of these facts. So with this I conclude. Thank you.